Hello and good afternoon, everyone. Welcome to the annual Wellness Visit Telehealth webinar today. My name is Jonah. I'm one of the training team members, and I will be conducting the webinar today. So as we get started, we're just going to go ahead here. So today we're going to talk about what exactly is the annual wellness visit, how we can adapt the annual wellness visit to the telehealth to be in compliance with CMS and other insurances, our product and how it can help you do the annual wellness visits. We're going to talk a little bit about advanced care plan, how you can do it with the annual wellness visit, but also why it's very important to do it regardless if you're going to do it separately. We're going to talk a little bit about reimbursement, billing, some CPT codes, just kind of give you an idea of exactly what the annual wellness visit reimbursement will be. And then finally, just giving you an idea of how to activate it on your EMR. I do ask that you save all of your questions till the end. At that time, I will go ahead and open the floor, and you can go ahead and ask any questions that you guys have at that time. I appreciate it. Thank you. So let's go ahead and get started. So what exactly is an annual wellness visit? It's basically a program that the primary care providers provide as yearly for their patients that they already have established. And these patients come in, they're basically going to create and update a personalized prevention plan for these patients. We don't want to confuse this with the annual physical exam and your initial physical exam for Medicare. So the physical exams are completely different from the annual wellness visit. In the annual wellness visit, I'll talk about all the different components and how it exactly works. But the annual physical is actually not covered under Medicare. And the annual physical is a separate entity from the annual wellness visit. And again, the annual wellness visit is for you to create a personalized prevention plan for your patients, kind of a roadmap for the next 5 to 10 years. But we'll get to every single component to it, to the annual wellness visit in just a second. But how can this actually benefit you and your practice? The most important thing is that you're creating an open communication with your patients, especially during this time when we're not able to connect with those patients who may be a little bit too fearful to come into the clinic. The annual wellness visit will actually be able to get in contact with those patients, be able to visit those patients who are isolated, and kind of screen your patients for any risky behavior and establish a good open communication with your patient. I'll also be able to help you identify any patients eligible for programs such as CCM and RPM. We've noticed that patients who have these conversations with their primary care physicians before they get enrolled with the program do much better and are much more in compliance to it. So that would be very good for you guys if you are doing CCM or RPM programs. Then you'll see that there'll be an increase of your patient volume because, if you're having low volume because your patients are not coming into the clinic, this is a great way to communicate with your patients and increase that volume for you. Also, it increases all your MIP scores because as you'll see in the components of what is in the annual wellness visit, it does check off a lot of your MIP scores. May not be relevant exactly right now, but in the future it will be. It's a good practice to get into. Okay, so let's talk a little bit about what the actual components of the annual wellness visit is. So the first one is doing a health risk assessment, just talking to your patient. It's a questionnaire that we'll provide for you, just going through each of your patients and talking to them about each of these areas. The next one is establishing and updating your patient's current medical and family history. You're going to be completing medication reconciliation, including a list of current providers. You always want to have this up to date so that you're always in the know of what's going on with your patients. You're reviewing the history or any present use of opioids, and you're doing a screening for depression. This is incredibly important during this time, especially with the increase of, with the isolation, increase of depression, anxiety. We're really in a kind of an unknown territory right now. So it's better to kind of get them ahead of time instead of having them come in when, everything finally opens up. And then, we're also doing screening for alcohol misuse, tobacco misuse, and substance use. So this is, again, people are isolated. They're going to go for that alcohol, the tobacco. So we want to make sure we're screening and we're getting ahead of everything. And then there's certain components that kind of need to be modified a little bit to be in compliance in order to, when we do the telehealth, that we're making sure it is being fully in compliance to that. So when we're billing, it'll be good. So the first one is recording the BP, height, weight, and BMI. So these things can be self-reported by the patient if the patient has a BP machine and is able to get their height and weight. If they're unable to do this, we just have to make sure we're documenting that in their records. In the actual visit, we're saying, hey, we're unable to receive these due to the COVID emergency. As long as we document that, it is good. The second thing that we do need to kind of adapt is detecting the cognitive impairment. Usually they'll be in your office, you'll be able to kind of monitor them and observe them in order to see what the cognitive impairment of the patient is, and you could do like a mini cog. If they have a healthcare or a care provider and you're able to get the mini cog to them and have them draw the circle already for the clock, you're still able to conduct the mini cog. But we've also created a questionnaire for you to kind of go through and assess your patients. This will be very much clinical judgment based, and this is why it's very important to have the telehealth so that you're seeing a face-to-face encounter with them, and you are using the camera of the telehealth. And then finally, we're going to be screening for balance and gait and the fall risk assessment. So balance, gait, and the fall risk would be done initially by doing, like the timed up and go. However, we don't want to do this if the patient is at risk for a fall and there's no one there for them. So if they, again, have a care provider, a caregiver that is there with them and is going to be of assistance to you, you can do that. Otherwise, we would just go ahead and do the fall risk assessment, which would be part of the the health risk assessment, and that would be in compliance for that. So once you have all of this completed, we're going to basically be creating the personalized prevention plan with this information. So that is basically your 5 to 10 year roadmap on the patient, creating things, making sure they know when they're going to be getting their screening, immunization, any other procedures that they need to be done for any prevention treatment. So all of this will be created and given to them. The great thing is all of this can be done by your nurse or a MA, if you do have one of those available to you, under your supervision, so that you're not, if you don't have the 30 to 45 minutes to spend with the patient, you can have them do that and then just come in to create the personalized prevention plan and sign off with your patients. Okay, so these are the things that are part of it, and talking about a little bit about how we're adapting that. So let's talk about how our product can actually help you do all of this, because it is quite a bit, and you want to make sure that you are in compliance so that when you send off all of your claims that you don't get any rejections for it. So the first thing is when you activate our annual wellness, you're going to get all the wellness forms. So all the forms that we just talked about, the health risk assessment, you're going to get, the fall risk assessment, you're going to get all the screening tools, the PHQ-9, all of that's going to already be nicely put into a form for you, and you'll be able to go through everything. And this is also great if you're going to have an MA or a nurse do this for you, so that they can go through it themselves and be able to talk to your patients without having any confusion. The next thing you're going to get is the wellness tracker. So this is a great tool that we use to assess all eligible patients. You'll be able to track them. You'll be able to see who has had a wellness visit, when the next visit is, if they're due for one right now, and you'll be able to see all of that. We will do the billing for the annual wellness visit, so you don't have to worry about it. I know I'm going to talk a little bit about the reimbursements, but you won't have to worry too much about the coding if you're using our technology. The next is we are going to have a appointment generation text to all eligible patients. So this is just going to be like a blast so that you don't have to be calling each individual patient up being like, hey, you're eligible for the annual wellness. This will let them know that they are eligible and they're able, they should call to book the appointment. The next is once the appointment is booked, you're going to have an appointment reminder text to all of your patients so that when they are scheduled, they're good to go. We are also including the telemedicine platform. If you haven't already signed up for the telemedicine platform, this will be available for you in order to do the annual wellness visit. And then finally, you'll get full training on how to use the system. All of this would be at a low cost of $25 for you, which is just a fraction of what you would get in the reimbursements. Again, we'll talk about it in a second. And eventually, once COVID-19 has settled down, there are other services that we can provide, such as having a nurse come into the office under your supervision and conduct the visit for you. So a little bit ease there. But that's basically our product. Let's talk and let me show you a little bit about how the product looks so you kind of have an idea. So the first thing you're going to see is this is the annual wellness initial visit forms. So when you go in, you click on it, this is all the information you're going to get. And all you'll have to do is click on each of these, and then it's going to give you a list of questions to go through. So once you're going through it, this is what it's going to look like. So every section will have subdivisions, and then every subdivision has questions for those. So you would just go and say yes or no, or it'll be a fill in the blank for you. So once you're done that, this is what you're going to get at the end. You're going to get a PDF with all of the information. It's going to autofill all of the information for you, so that way you know that it is compliant with CMS and all the other insurance. I do keep saying CMS, but private insurances are going to be covering the annual wellness visit as well. Just FYI, especially with the telemedicine. So there is no need to worry about that. So once you get all of this, you would just upload it into your patient's form, have them sign it, have yourself sign it, and it's good to go. Okay, so that was all the annual wellness visit. Now let's just touch a little bit about the advanced care plan. So what they have been saying is, especially during this time, we kind of want to make sure that we're asking these questions to our patients and we're getting in touch with them about any advanced directives. It is a very unsure time. We don't know what's going on. The death toll keeps rising. There's a lot of very, very sick people. We want to make sure that we're always in compliance with what the patient wishes. And these are difficult conversations that you might have to have with your patient, and maybe you don't have enough time to do with the annual wellness visit, but we always want to touch upon it, and it would be a good opportunity right now for you to do that. Basically, you're going to have to do a documentation of a brief summary of, that this was a voluntary discussion with the patient, any complexities that you might have talked about, and then we want to make sure we have the duration actually documented there. So when you started and then the exact time that you ended, because there are going to be different codes depending on how long the actual conversation takes. And then we also have all the forms available for you in terms of the advanced directed on the EMR. So once you are ready to go through that, you guys can go ahead and get that from the patient's chart, have them sign it. So either send it to them by mail or send it to them through the patient portal, have them sign it, return it to you, and then you can upload it onto the EMR. Okay. So let's talk a little bit about reimbursements and what you could be getting back if you were to do the annual wellness visit. So depending on the what exactly you guys do, what kind of counseling you do, what kind of screening tests you guys are able to do during the annual wellness visit, you guys can get anywhere between $150 to about $220, $250 as reimbursements. If you guys do add the advanced care plan to it, it will be even more than that. So it's just depending on how much time you guys have and what you guys are able to do. And as you can see, there are different codes depending on if you're doing an initial visit versus subsequent annual visit, and then the depression screening, alcohol screening, smoking cessation, all of this are extra. Again, you won't have to worry too much about these codes. The reason for that is if you do use our product, all of this is going to be included in it. We'll do the billing. We'll make sure that you're getting your highest reimbursement back, so you won't have to worry too much about that. And then again, with the advanced care planning, there are 2 different codes. So one for the first 30 minutes, and any additional 30 minutes after that, there is the extra code that you can put in. Because we do understand it could be a long conversation, especially, wanting to make sure that you are having all of the concerns that the patient may have answered. Okay? So that is everything that I have for the annual wellness visit and the advanced care plan. If you want to activate it, you want to get it started, how can we do that? Reach out to your sales rep. You can reach out to the training team. We're more than happy to help you activate it and walk you through the system. If you do have an account representative that you have been going back and forth with, go ahead and talk to them, and they're able to, get that activated for you. So our telephone number for the training team is 973-200-7308, and then our email would be training@ehieh.com. Okay, so now I am going to open up the floor to any questions. I would appreciate it if you guys want to go ahead and drop the questions in the little Q&A box.